Time now for our ECU Health Spotlight. And in the spotlight this morning, Dr. Jeff Barwick, who is an orthopedic surgeon with ECU Health in Washington at Beaufort County Hospital. ECU Health Beaufort County, I should say. And we're going to talk about carpal tunnel syndrome this morning. Dr. Barwick, good morning, sir.
Good morning.
And we're just talking about the fact that you're a Greenville native. You grew up here, and I knew your grandfather.
Yes, sir.
Yeah.
Yes, sir. Born and raised in Greenville, graduated in '91 from Rose High School.
That's awesome. So tell us a little bit about your work at ECU Health at Beaufort County.
So I actually went to ECU Med School, graduated from ECU in 2004. Go Pirates.
Yeah.
Went off to Ohio to do my orthopedic residency. I then followed that in Chattanooga, Tennessee with a trauma fellowship in orthopedics. My wife and I did the interview trail while I was in fellowship, and we actually considered coming back to Greenville. It was top on the list, and we went and interviewed in Washington. There was a surgeon there named Dr. Birdsong, and we just fell in love with him. We fell in love with the community. Obviously, I'm born and bred here. When I say here, all of Eastern North Carolina. So Washington was just a
perfect fit.
A perfect fit.
Yeah.
And anyway, I'm trained in trauma, so that's my fellowship. But if you're in a small town like Washington, there's two surgeons. My partner's Dr. Couch, so Dr. Couch and myself have to take care of pretty much anything that walks in the door.
Interesting.
So I'm trained in trauma, but I also do a lot of hand surgery. I do a lot of joint surgery as well, but hand surgery is definitely, we would say, bread and butter.
Well, that's what we're going to talk about this morning, carpal tunnel syndrome. First of all, what is it?
So carpal tunnel syndrome is, there's a nerve that's in the wrist. It's called the median nerve. The median nerve goes through this tunnel in the wrist. That's why it's called carpal tunnel.
I've always wondered about that. I'm glad you clarified that.
Yeah, so there's bones on one side, there's tendons on the other side, the median nerve's in there with the tendons, and then there's a ligament that sits on top. With time, there's less space. It's an inflammatory condition where there just becomes less and less space. So yes, it happens more in adults. As kids, we just don't have as much repetitive motion to close down that space. But in adults, the space starts to close down.
So that's what causes it, repetitive motion?
Repetitive motion is definitely one of the biggest risk factors. Age, repetitive motion, some other risk factors are women are a little more at risk, obesity. But yeah, repetitive wrist motion. So just think of all the people that are on a keyboard all day or in a factory just doing repetitive motion. You know, think of the workers at Grady White Boat or one of our, great boat factories here that are just constantly waxing and working with
repetitive
fiberglass.
Motion with that wrist.
Exactly.
Yeah. So that's what causes it. And of course, we live in an era now where we're all sitting on our laptops all day. What can we do about that? Is there anything we can do to mitigate the possibility? If because I'm one of them. I sit on my laptop quite a bit.
Absolutely. So I do think computers are better now, so that the keyboards are more easier to have good wrist position.
So did they address that? Is that computer companies have done something with these things?
I do believe so. And then there's extra pads that you can buy. But what you want to avoid is bending the wrist. So if you can avoid flexion of the wrist and have it more straight, then that helps to alleviate some of the symptoms. So a lot of repetitive flexion of the wrist closes down that space and compresses the median nerve.
So let's talk about treatment. Is there anything you can do other than surgery?
Absolutely. So if you think about when you're sleeping, most people sleep almost like in a fetal position. You kind of curl up your wrist and kind of curl up your elbows. Well, when you're curling up your wrist, you're closing down the space. So a splint that helps to hold your wrist straight helps to keep the space a little more open. So night splints definitely work. As we talked about, if you're on a computer, trying to keep your wrist straight as you're typing. If you're on a phone a lot, try to use the speaker function instead of just holding the phone where your wrist is flexed. Injections into the carpal tunnel with a steroid can help relieve the inflammation, so that's a non-surgical option as well. And then anti-inflammatories like Advil, Motrin, that type of thing can help. But obviously the kidney doctors out there are not big fans of the NSAIDs because they can have side effect of hurting the kidney. So you have to be careful with that.
Right. Let's talk about new technology. There's some new technology that you're using now that help people who have carpal tunnel.
Yeah, absolutely. So I mentioned Dr. Birdsong. He's now director of a hand fellowship in Pittsburgh. So he moved away shortly after I joined him.
From Washington to Pittsburgh.
Yes, yeah, but really good hand surgeon. I respected him quite a bit. Still respect him. He actually taught me some tricks to do carpal tunnel. Of course, you learn it in residency. All orthopedic residents learn it. But he taught how I could do a smaller incision in the palm of the hand. And I thought I was pretty cool doing a pretty small incision compared to some of my colleagues. And this is called a little mini incision, but it's in the palm of the hand, and you still have to cut through muscle to get down to the ligament that sits over the median nerve. Well, cutting through that muscle slows down the rehab process. Even though it's a small incision, you're still cutting through the muscle.
Yeah.
I've probably done at least 1,000 of those surgeries, and patients do well. But it really hit home when I operated on some colleagues that worked with me in the operating room. And I do their surgery. Surgery goes great, and 6 weeks rolls around. And I'm like, hey, where's my colleague? They're still out of work because he doesn't have complete grip strength. Game changer as far as a successful surgery. All pain was gone, sensation returned, but still having some clumsiness in the fingers and still a little pain, not full grip strength. So sorry for the long answer, but now we're using ultrasound. Ultrasound is not new technology at all. It's been around forever. You know, you're getting ultrasounds for in obstetrics and checking on the baby. But now ultrasound is being used more and more in orthopedics. And with ultrasound, we can put the probe in the palm of the hand. We can look into the palm of the hand. We can see the median nerve. We can see all the structures. So those become my eyes. And now I can make a very small incision. And
even smaller than before.
Much smaller, and I come in under the muscle.
So you don't have to cut through the muscle.
I do not cut through the muscle. So recovery time has been cut down to days. Where
so that's positively impacting the people who've got to have the surgery.
Absolutely.
I mean, that's great.
Absolutely.
All right. So what resources are available for people in Eastern North Carolina to learn more about what you do and carpal tunnel treatments?
Well, it's my hope that we get our website up with more information directly on this surgery. We're currently working on that. But for now, what I would tell everyone is just to call our office. We have really good brochures educating folks on what they can do non-operatively, and if they want to consider the procedure, then certainly that's an option as well. Our phone number is 252-946-6513. That's for our office in Washington. But we have a lot of brochures. Call us. We'll mail them to you if you'd like. And on that brochure are some web addresses that we'll send you to as well.
Great information. And sounds like you're doing some cutting edge stuff there with carpal tunnel.
No pun intended.
I hope I don't need it, but it's good to know that it's there.
Yes, sir.
So appreciate you being here this morning. It's nice to meet you.
Yeah, good to meet you.
Dr. Jeff Barwick, orthopedic surgeon with ECU Health Orthopedics in Washington.